Are you in your golden years, struggling with constipation that just won't go away? If you're nodding right now, you're definitely not alone. This is one of the most common and honestly most frustrating digestive issues older adults face every single day. And here's the thing. Constipation isn't just a minor inconvenience. When it sticks around, it can lead to bloating, stomach pain, poor appetite, and even more serious problems like hemorrhoids or bowel blockages. And the worst part is that many people either ignore the issue or keep reaching for pills and laxatives that only offer short-term relief without truly fixing the problem. But why does this become more common as we age? Well, our metabolism slows down. We tend to move less, and many seniors are on medications that affect gut function. Add in less fiber, not enough water, and before you know it, your digestion hits the brakes. But here is the good news for you. You don't have to live with it, and you don't have to rely on pills either. There are natural, everyday foods that can gently get things moving again. These foods are easy to find, safe for older adults, and they work with your body, not against it. So in this video, we're talking about the top 5 natural laxatives that are safe for seniors, no pills needed. And make sure you stay with us until the end, because we'll also share 4 common foods that might actually be making your constipation worse, even though they seem totally harmless. All right, without any delay, let's get started with number 1 on our list, and this one might surprise you. It's a fruit that's been trusted for generations and has quietly built a reputation as a natural remedy for digestive troubles. We're talking about prunes, which are simply dried plums. Now, if that makes you think of something old-fashioned or something your grandparents used to eat, well, don't be too quick to dismiss them. Prunes are actually one of the most effective and scientifically supported natural laxatives out there. So, what exactly makes prunes so helpful when it comes to constipation? Let's break it down. Prunes are an excellent source of insoluble fiber. Now, if you're wondering what that means, here's a simple explanation. Insoluble fiber is the type of fiber that does not dissolve in water. Instead, it stays intact as it moves through your digestive system. What it does is add bulk to your stool, almost like giving it more weight and texture, which helps stimulate movement in your colon. That makes it easier for waste to pass through your system more smoothly and regularly. But fiber isn't the only thing at work here. Prunes also contain a natural sugar alcohol called sorbitol. Sorbitol has a gentle laxative effect because it pulls water into the colon. That added moisture softens the stool, making bowel movements easier and more comfortable. And if that wasn't enough, prunes are also rich in phenolic compounds, which are natural plant chemicals that may help stimulate the muscles in your colon, encouraging healthy movement. And yes, this isn't just a home remedy that people swear by. It's backed by science. In a study published in the journal Alimentary Pharmacology and Therapeutics, researchers found that prunes were even more effective than psyllium fiber supplements in improving stool frequency and consistency in adults with chronic constipation. So this little fruit really holds its own in the research world. Now, if you're in your senior years, chances are you're not just dealing with constipation. You might also be managing other health concerns like diabetes, high cholesterol, or bone loss. The good news is that prunes may help with all of those. They're a great source of potassium and boron, which are both important for supporting bone density, especially in older adults who are at greater risk for osteoporosis. The fiber in prunes may also help slow the absorption of sugar in your bloodstream, making it easier to manage blood sugar levels if you have type 2 diabetes. And for cholesterol, studies suggest that diets rich in fiber, especially from natural fruits like prunes, may help reduce low-density lipoprotein cholesterol, or bad cholesterol levels, over time. So, how do you eat them the right way? Most people benefit from eating 3 to 5 prunes per day. You can enjoy them as a morning snack, stir them into your oatmeal at breakfast, or even add them to a smoothie after lunch. But if you're specifically dealing with constipation, a helpful tip is to eat your prunes first thing in the morning on an empty stomach, along with a glass of warm water. This helps kickstart your digestive system and promotes a smoother bowel movement later in the day. However, here is an important tip. Start slow. Prunes are very effective, but if your body isn't used to that much fiber, eating too many too quickly may cause gas, bloating, or a bit of discomfort. And if you're living with diabetes, keep in mind that while the sugars in prunes are natural, they can still affect your blood sugar levels. So enjoy them in moderation and monitor how your body responds. When buying prunes, look for ones that are unsweetened and preservative-free. California prunes are a great option. They're grown in the US and are known for their high quality. To store them, keep them in an airtight container in a cool, dry place. If you're not eating them regularly, you can even store them in the refrigerator to help them stay fresh longer. Now that we've covered prunes, let's move on to the second natural laxative on our list. And this one is tiny but mighty. In fact, you've probably seen it sprinkled on smoothie bowls or floating in trendy drinks. But don't let their size fool you. These little seeds are a powerhouse when it comes to digestion, hydration, and even heart health. They may be small, but once they hit water, they expand, literally, and work wonders inside your gut. Any guesses? Yes, we're talking about chia seeds. Chia seeds are one of nature's most effective and gentle laxatives. Unlike prunes, which work through insoluble fiber and sorbitol, chia seeds are incredibly rich in soluble fiber. Soluble fiber forms a gel when it mixes with water. Inside your digestive tract, this gel adds softness, moisture, and gentle bulk to your stool. It also helps the intestines contract and move waste more smoothly through your system, so you're not straining or feeling blocked up. But here's where chia really shines. Hydration. These seeds are excellent at holding on to water, which helps keep your digestive system lubricated from the inside out. That's especially important for seniors who often don't drink enough fluids during the day. A well-hydrated gut is a more efficient gut, and chia helps create that balance naturally. Now, if you're in your senior years, you might be dealing with more than just constipation. And here's some great news. Chia seeds offer multiple benefits beyond digestion. They're packed with omega-3 fatty acids, which are essential for heart health, helping to lower bad cholesterol and reduce inflammation. They can also help regulate blood sugar, making them a helpful food for those managing type 2 diabetes. Plus, they're a natural source of calcium and magnesium, two minerals that are crucial for strong bones and preventing bone loss as we age. So, how do you eat them the right way? The ideal amount is 1 to 2 tablespoons per day. But there's one rule you should never skip. Always soak them first. Dry chia seeds can absorb up to 10 times their weight in liquid, and eating them without soaking can actually be a choking risk or cause stomach discomfort. So the best method is to mix them into water, juice, or milk, and let them sit for 10 to 20 minutes. They'll form a thick gel-like texture. This is when they're most beneficial and easiest to digest. You can then add soaked chia to smoothies, yogurt, oatmeal, or even drink them straight in lemon water. Timing-wise, the best time to consume chia seeds is in the morning, either with breakfast or just before. Starting your day with chia can give your digestive system a gentle, hydrating boost and help promote regular bowel movements throughout the day. They're also great as a midday snack. Just make sure you're staying well hydrated because chia pulls water into the gut as it works. However, here's an important tip. Start slow. If your body isn't used to this much fiber, jumping straight to 2 tablespoons may lead to gas or bloating. Begin with just half a tablespoon, then gradually increase over the week as your body adjusts. And remember, drink water regularly throughout the day to support chia's gel-forming action and prevent discomfort. When buying chia seeds, look for organic, whole seeds, either black or white. Avoid highly processed chia powders, as they can lose some of the healthy oils and texture that make chia seeds so effective. For storage, just keep them in a sealed jar or container, either in your pantry or the fridge. When stored properly in a dry, cool place, they can stay fresh for several months. Now, chia seeds might seem tiny, but as we've seen, they pack a powerful punch for your digestion. And here's what's interesting. Some people see results in just a day or two, while others notice steady improvement over a week. It really depends on your hydration and how your body responds. Have you ever noticed any changes in your digestion after adding chia to your meals? Drop a comment and share your experience. It could be the tip someone else needs right now. All right, moving forward, the number 3 on our list is one you might already be enjoying, but maybe not realizing just how powerful it really is for digestion. It's warm, comforting, and probably one of the easiest breakfasts to prepare. Any guesses? Here's a hint. It's been a staple in American kitchens for generations, and it's especially popular on cold mornings. Yes, we're talking about oatmeal, and not the sugary instant kind, but good old-fashioned steel-cut or rolled oats. But how does oatmeal actually help with constipation? Let's break it down. Oatmeal is rich in soluble fiber, particularly a type called beta-glucan. As we mentioned earlier, this fiber works by absorbing water in your digestive tract, forming a soft, gel-like substance that makes your stool easier to pass. But beta-glucan takes it a step further by also supporting your gut health. It also feeds the beneficial bacteria in your gut, which helps keep everything running smoothly on a regular basis. And here's something many people don't know. A healthy gut microbiome directly supports better digestion. So, by feeding the good bacteria with the fiber in oats, you're naturally supporting better regularity without needing harsh medications. Now, if you're in your golden years and also dealing with other concerns like high cholesterol or blood sugar issues, oatmeal can be a smart and gentle solution. Beta-glucan has been shown in several clinical studies to reduce low-density lipoprotein cholesterol, sometimes called bad cholesterol. And thanks to its slow-digesting nature, oatmeal helps stabilize blood sugar levels, making it a senior-friendly choice for those managing type 2 diabetes or prediabetes. So, when's the best time to eat it? Breakfast is ideal. Having a warm bowl of oatmeal in the morning gives your digestive system a soft start to the day. Plus, it keeps you full longer, which can help control snacking and improve appetite patterns throughout the day. You can prepare about 1 cup of cooked oatmeal, and to really boost the fiber content, top it with digestion-friendly fruits like banana, prunes, or sliced apples. That combo turns breakfast into a natural, effective laxative without any pills or side effects. Now, a quick tip here. Try to avoid instant oatmeal, especially those flavored packets with added sugars and artificial ingredients. They might be convenient, but they're stripped of most of the fiber and may even cause sugar spikes. Instead, go for steel-cut oats or old-fashioned rolled oats. They're minimally processed, full of fiber, and easy to digest when cooked right. You can prepare them with water or unsweetened almond milk if you're aiming for a lighter dairy-free option. And if you're sensitive to fiber or just starting to increase your intake, begin with a small serving and gradually build up over a few days. This gives your digestive system time to adjust and avoids any temporary bloating or discomfort. As for storage, just keep your oats in a dry, airtight container. They stay fresh for up to 6 to 12 months when stored properly in a cool pantry. So you can buy in bulk and use them daily without worry. And here's a quick question for you. How do you usually like your oatmeal? Do you add fruit, nuts, or maybe a little cinnamon? Drop your favorite combo in the comments because you might inspire someone else to give this fiber-rich classic a second look. All right, so we've talked about warm, fiber-packed oatmeal, but now let's take it in a slightly different direction. This next one isn't something you have to cook. In fact, it's one of the easiest, most convenient foods you can grab on the go. And here's a fun hint. There's a reason people say it keeps the doctor away. Yes, you guessed it. We're talking about apples. So why do apples work so well? Let's break it down. Apples are rich in a type of soluble fiber called pectin. Once inside your digestive tract, pectin pulls in water and forms a gel-like texture. This helps soften your stool and make bowel movements smoother and more regular. And that's not all. Apples also contain insoluble fiber, especially in the skin, which helps bulk up the stool and support natural movement through the intestines. As we mentioned earlier, this kind of fiber gives your gut something to push along, which is exactly what your system needs when digestion slows down. Now here's something that often goes unnoticed. Apples are made up of about 85% water. That means they help keep your digestive tract hydrated, which is absolutely essential for preventing constipation. It's a simple snack, but it works on multiple levels. Fiber and hydration working together in your favor. A good routine for most people is to eat one medium apple per day, preferably with the skin on. That's where most of the fiber and antioxidants live. Try having it as a mid-morning or afternoon snack, something to hold you over and support your digestion at the same time. And if you're worried about blood sugar, here's some reassurance. Apples have a low glycemic index, meaning they digest slowly and won't spike your sugar levels. That makes them a great option for anyone managing type 2 diabetes or looking to stabilize energy throughout the day, but it doesn't stop there. Apples have been shown to support heart health thanks to their fiber's ability to help lower low-density lipoprotein cholesterol. And for older adults concerned about cardiovascular health, that's a powerful bonus. And now, here's just a quick word of caution. If you're living with kidney concerns, apples do contain potassium, so it's best not to eat more than one a day. And like with all high-fiber foods, it's smart to introduce them gradually if you haven't been eating much fiber lately. Starting slow helps avoid gas or bloating while your body adjusts. When buying, stick to fresh, crisp apples like Fuji, Gala, or Granny Smith. Choose organic when you can, especially since you'll be eating the skin. Keep them stored in the fridge to preserve their crunch, and for best quality, try to enjoy them within 2 to 3 weeks. And now, we're heading to the final item on our list, and it's one that's not just good for digestion, but also known for calming the entire body and nourishing it from the inside out. So, what's green, leafy, and often underestimated when it comes to digestive health? Yes, we're talking about leafy greens. Powerhouses like spinach, kale, and collard greens. Now, if you're someone who's always seen them as just a side dish or something you should eat but don't really enjoy, it might be time for a second look. Here's the deal. Leafy greens are rich in fiber, magnesium, and water, a triple action combo that can work wonders for constipation. As we mentioned earlier, fiber helps bulk up the stool and move it through your system. But here's something many people don't realize. Magnesium plays a key role too. It helps relax the intestinal muscles, allowing your digestive system to move food more smoothly. That's why foods high in magnesium, like spinach, are often recommended as gentle, natural laxatives. But that's not all. These greens are also incredibly hydrating. Since dehydration can be one of the hidden culprits behind constipation, getting more high-water foods into your diet can make a real difference. And leafy greens deliver. So how much should you aim for? A good starting point is 1 to 2 cups of cooked greens per day. Cooking them helps reduce volume, making it easier to eat more without feeling overwhelmed. Try steaming, lightly sautéing with olive oil, or even blending into smoothies if you want something cold and refreshing. And here's a flavor tip. Add lemon juice and a touch of garlic. Not only does it taste great, but lemon helps stimulate digestive enzymes, and garlic supports gut-friendly bacteria. Now, if you want another easy trick, toss a handful into scrambled eggs, soups, or casseroles. They cook down quickly and bring a soft texture that's easy on the gut. However, there are just a few things to keep in mind. If you're on blood-thinning medications like warfarin, it's important to monitor your intake of vitamin K, which is found in abundance in leafy greens. Talk to your healthcare provider before making major changes. And for those with sensitive stomachs, eating large amounts of raw greens can sometimes cause cause bloating, so it's best to cook them if you're prone to digestive discomfort. And when
now
shopping,
here's something
fresh
extra
or
important.
frozen organic greens are your best bet. Pre-washed baby spinach is a great convenience option and tends to be more tender and mild in flavor. Store fresh greens in your crisper drawer and aim to use them within 5 to 7 days to keep them fresh and full of nutrients. And now here's something extra important, especially for those of you navigating senior health. These greens are packed with iron and calcium, which is crucial for those at risk for anemia or osteoporosis. They also support heart and kidney health. And their anti-inflammatory compounds can help reduce joint pain and boost overall vitality. And there you have it, 5 natural laxatives that are gentle, effective, and totally safe for seniors. No pills needed, just simple, wholesome foods working in harmony with your body. But here's something equally important that we absolutely need to talk about. Because let's face it, even if you're loading your plate with all the right foods, your efforts can be completely undone by a few sneaky items in your diet that may be silently working against you. That's right. Certain seemingly nutritious, everyday foods could actually be making your constipation worse, and you may not even realize it. So if you're serious about staying regular, feeling lighter, and improving your digestive comfort, then knowing what to avoid is just as essential as knowing what to include. Let's take a look at the top 4 constipation-causing foods, especially important to watch out for if you're in your golden years. First up, let's talk about something that many of us love and reach for without thinking: cheese and dairy products. Now we get it. Cheese is delicious, creamy, and comforting, but unfortunately, it can also be a major culprit behind sluggish digestion. Dairy is naturally low in fiber, which means it doesn't support healthy bowel movements the way fruits or vegetables do. Plus, dairy products like cheese, milk, and ice cream tend to be high in saturated fats, which can slow down the digestive process. For seniors who may already have slower gut motility due to age, that extra fat can really gum up the works. And here's a little known fact: many older adults become lactose intolerant over time, even if they tolerated dairy just fine when they were younger. That intolerance can cause bloating, gas, and, you guessed it, constipation. So if you're consuming dairy regularly and finding your digestion is off, this might be a silent trigger worth cutting back on or switching to lactose-free alternatives. Now, moving on to number 2, and it's a big one: red meat. Whether it's a juicy steak or a burger on the grill, red meat is another food that's easy to love, but hard to digest. It contains no fiber at all, none, which means it offers your digestive system zero help in moving things along. But that's not all. Red meat is also high in protein and saturated fat, which can slow down digestion and increase the time it takes for food to pass through the colon. Here's the sneaky part: red meat often takes the place of fiber-rich foods. So instead of loading up on vegetables, beans, or whole grains, many meals end up centered on the meat itself, which just compounds the problem. You don't have to give it up entirely, but moderation is key. And when you do eat meat, be sure to balance it with a generous portion of veggies or a side of lentils or quinoa. All right, the next one might be sitting in your pantry right now: processed foods. Think chips, crackers, frozen dinners, pastries. These are the types of items that are easy to grab, require no prep, and feel like comfort food. But they're doing your digestion no favors. Most processed foods are very low in fiber and high in things like unhealthy fats, added sugars, sodium, and artificial additives. Why does that matter? Well, these ingredients can irritate the gut lining, dehydrate you, and disrupt the balance of good bacteria in your intestines, all of which contribute to constipation. And when you combine that with low water intake and reduced activity, it's a recipe for serious discomfort. If you rely on convenience meals, look for healthier versions made with real ingredients and pair them with fresh fruits or steamed veggies to get some fiber back into the mix. Now, let's talk about something that sounds healthy but can backfire: white bread and refined grains. We're talking about that fluffy sandwich bread, white rice, or regular pasta. These grains have been stripped of their outer layers, which means they've also lost most of their fiber and nutrients. What you're left with is a carbohydrate that digests quickly and offers very little bulk to your stool. The result? Slower moving digestion and fewer trips to the bathroom. What's worse, these refined grains can also spike your blood sugar, something many seniors are already managing due to diabetes or insulin resistance. The good news is you don't have to give up bread or pasta altogether. Just switch to whole grain versions, like whole wheat bread, brown rice, or oats, which still have their natural fiber intact. Now, before we wrap up, let's talk about some final tips that can make a world of difference, especially for seniors trying to improve digestion naturally. First, hydration. We cannot stress this enough. Your body needs water to help fiber do its job. Aim for at least 6 to 8 cups of water daily, and even more if you're eating high-fiber foods like chia seeds or oatmeal. Warm herbal teas, water-rich fruits, or even a little lemon water in the morning can help keep things moving. Second, stay active. A simple 15 to 30-minute walk, gentle chair yoga, or stretching exercises can stimulate your intestines and promote regular bowel movements. Movement really is medicine when it comes to digestion. Third, stick to a routine. Your body loves rhythm. Try to use the bathroom at the same time every day, ideally after breakfast, when the digestive system is naturally most active. This helps train your body and creates a consistent rhythm. And lastly, remember this: fiber works best when it's balanced. That means combining both soluble fiber, which softens stool, and insoluble fiber, which adds bulk. The foods we shared today help you get both in a natural, nourishing way. So, there you have it: what to eat, what to avoid, and the simple daily habits that make it all work together. If you found this helpful, don't keep it to yourself. Share it with a loved one who might be struggling with constipation or digestive discomfort. And if you're looking for more easy, science-backed wellness tips designed especially for seniors, be sure to subscribe and turn on notifications. That way, you won't miss our upcoming videos on topics like digestion, joint health, blood pressure, and more.